So the question was, should breastfeeding hurt? And the simple answer is no. The more complicated answer is sometimes breastfeeding may feel a little bit uncomfortable. There may be a different sensation if you've never breastfed before. And as your baby is learning and you are learning together, in those early days, when baby's learning to open their mouth well and they're quite sleepy and things like that, there may be in the first few seconds some discomfort, but usually, and it should, the discomfort should fade away. If there is consistent pain or pain that is more than just discomfort and goes on past those initial couple of seconds on the initial latch, then that is a sign from the body that something's going on and that warrants some more support. So usually it is just the case that baby is latching what we call a shallow latch. So the baby's not latching deeply enough. When we talk about a deep latch, we're talking about a baby that is able to really tilt their head backwards and latch deeply and anchor on with their chin, taking in the bulbous part of the breast, and they are taking in a lot of the areola and not just latching on the nipple. And that is when usually that's where the pain is coming from. Majority of cases, it's just a very slight movement of mum's body, of your body, or of baby, a slight positional change. Really, it can be very minute change to make a huge difference so that you can be pain-free breastfeeding. One thing to mention is that sometimes as breastfeeding counsellors, we support mums who've said, oh, well, I know it can't be a latch issue because I've seen this person and they have said that the latch looks fine. So bear in mind that your experience of breastfeeding, your comfort, is almost like a barometer of how breastfeeding is going. And so if you are experiencing pain, then that is a signal that there is something going on there. So that is a good time to really reach out and seek specialist breastfeeding support, such as from a breastfeeding counsellor. There are obviously other issues that may cause pain, such as breastfeeding infection like mastitis or thrush, and other there may be other times where, for example, a baby has an anatomical issue such as a tongue tie or a high palate, which may cause pain. But again, this is something that your breastfeeding counsellor can help you to unravel and assess. And if there are ever any reasons to rule out anything medical, of course, that would be discussed as well. And then you would need to speak to your midwife, health visitor, or GP. But in the majority of cases, in the high majority of cases, it is positional changes, and the majority of mums then go on to breastfeed with no pain at all and comfortably.